Well, good Monday morning to you, and welcome to our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy, with Drs. Jim and Janine Fox of Doctors Nutrition. They're located on Cowan Road in Gulfport, south of Pass Road. We always have something different that we talk about every week, and even if we don't talk about a particular subject that you thought about over the weekend bothering you, you can still call in and ask a question. 896-0713. Or 800-349-0713 are our phone numbers, and you can call in and pass your question along to the doctors. Everybody's over cruising the coast, I hope.
Yep.
Had a great week. Weather was great for it.
Woo. It was. Couldn't get much better. Maybe a little cooler.
Yes. A little cooler.
Still a little bit hot, but
it was. But it's enjoying these very cool days and cool, mild days, cool nights.
Right.
That aren't bad at all. But anyway, today we're talking about the endocrine system and what it does for you, what you need to do to keep it healthy, why it's important to you. So,
well, it's very important because that's the way the various systems of the body communicate with each other. I mean, they send out these. There was a researcher many years ago named Candace Pearl, and she called them messenger molecules. I said, that's a really good name, because that's what they do. They carry a message, like from the thyroid around to the tissue. And then, of course, they have the adrenals, and you have the brain kind of overseeing everything. And then we have all these functional systems like the endocrine, like in the endocrine system, like the thyroid, the adrenals, even things like, for instance, the pancreas that produces insulin.
It's also part of the endocrine system.
All part of the endocrine system. So, everything, now they're even saying that the gut has some parts of that endocrine system because it produces some of the messenger molecules. And the bone even.
And even the production of melatonin is part of the endocrine system, which is the sleep cycle and your circadian rhythms. So that all is controlled by the endocrine system as well. So the endocrine system is one of the most important systems in the body.
I had someone talking to me over the weekend as saying that they don't haven't been sleeping well, that they needed to get some melatonin or something like that.
Melatonin does help.
The thing about melatonin, when a newborn is born, that's when they're going to have their highest amount of melatonin production. And as we mature and age, the production of melatonin goes down. And then things, that interrupt it, and something that we want to talk about today are things, what we call endocrine disruptors, things that can disrupt that endocrine system and cause problems. But like with melatonin, as we get a little older and stress, things like that, all these things add up and they will interfere with the body making enough of its own melatonin. So yeah, melatonin is a really good adjunct. And it's got a lot of really, some really neat research on anti-cancer. Yeah, it's a great antioxidant. I mean, who knows? There's so many things that we know now about melatonin. You used to think, it's just part of the sleep cycle thing, But now we know, no, it's got to do with the, as far as producing, certain antioxidants, protection of certain systems. It's amazing what it does, really.
And a lot of people that need it, as you said, the older that we get,
the lower the
melatonin, so you maybe need something. I know that my wife is taking the Best Rest,
and our Best Rest formula does have some melatonin.
Has a little bit in.
Has a little bit in there, and she sleeps like a baby.
Along with other relaxants, it's kind of like a relaxing formula with a little bit of melatonin. So it's got about 1 milligram, which is a very low amount. A lot of time, our melatonin by itself is like 3 milligrams, but if that's all someone needs, then that's really good for them, and it actually helps relaxation at the same time.
Yeah, I remember the time I came in and asked you what you probably remember. What do you have that's like melatonin? Melatonin.
Okay. Well, when you ask a question like that,
it's pretty much like it. It really is.
Well, it is the only thing like melatonin is melatonin.
Well, there you go. But the endocrine system, what are some of the things that, as we get older, I guess there are things that affect it that cause it not to send out those signals that it's supposed to?
Well, there's certain things that we talked about, these endocrine disruptors, and I think that's probably one of the biggest things. And a lot of research has been going on that for years. For instance, the bisphenol A. You watch plastics now, and it'll say BPA free, and the reason was BPA or bisphenol A actually is a big endocrine disruptor. It blocked and interfered with the thyroid function. It interfered with adrenal function. So we know that that's a real issue. Now, not only that, here's the bad part. They took out the BPA, and there's another one that they have called BPS or bisphenol S. So they took out bisphenol A, put in bisphenol S. Now, so you're better off to stay away from plastics all the way around. And for goodness sakes, if you buy one of these packages of something that says, "Oh, just throw the bag in the microwave," don't.
No.
Because that's just,
that's just
the
full
heat.
of it.
Well, they tell you, you should even, people will take, like they've stored something in Tupperware.
Don't do it.
And they'll stick Tupperware in the microwave and do it. No, glass is the best thing that you can do.
Glass
or paper.
Right.
I mean, a paper plate.
Yeah.
But only a paper plate with no dyes.
Right.
You don't want colored paper plates to etch.
It's got a plastic film over it.
You think about it, that
and
has
not
stuff on it, too.
styrofoam.
No,
not styrofoam.
Not styrofoam.
That's
Plain
the issue.
paper.
Yeah. And because when these things start, the bad thing about it, we live in a toxic environment. There's no doubt about that. You get things in the food, and with the glyphosate, for instance, we know how that interferes. We talked about that with your GMO foods. Big endocrine disruptor. And so all these things kind of add up. And unfortunately, sometimes medicine tends to just look at one little bitty piece or part of that endocrine system and says, "Oh, it's fine." You know your body. You know your body better than anybody. And if something's not right, you need to dig in and find out what it is. And sometimes it takes some pretty in-depth digging, if you will, to find out what it is. But it's usually part of that endocrine system.
But another one of the endocrine disruptors is phthalates, which is, people don't realize, it's in your shampoo, it's in your makeup, it's in your lotions, it's in, you got to look for phthalate free. And that's another endocrine disruptor. So you don't realize that everything.
Phthalate?
Phthalate. It's pH.
Okay.
He's going to write this
New
one down.
word.
You're going to look.
P-H-T.
L-A-T-E-S. I think.
Well, you left out an A or something.
We don't even left out a
Phthalates.
Don't quote the spelling here.
Okay, phthalates.
This is not a spelling program. No. But phthalates, but it does start with a P, P-T-H. And that's the phthalates, and they're plasticizers.
They're plasticizers, and almost all your.
So I guess your body absorbs them over a period of time.
Oh yeah, anything absorbs right through the skin, and for instance, so you put this stuff on your skin, put it on your face, ladies, and what you're doing is it's soaking right into your face, into the skin, into the bloodstream. There you go.
You'll note a lot of the natural cosmetics will actually say phthalate free, sodium lauryl sulfate free. It'll start telling you that's what you want, the ones that are not adding the extra chemicals that are endocrine disruptors, because the endocrine system just plays such a huge role in overall health, and we're disrupting it every time you turn around.
That's why more and more you do see more and more people that are going for more natural, makeup or creams or whatever, soaps.
You have to.
So all that.
Soap, shampoo, everything like that.
As you say, your life depends on it, because seriously, when you start looking at all these things that we do, and we don't think about, that have these endocrine disruptors in them, and you do that day in, day out, and then you wonder why I don't feel good. Goodness gracious. I mean, there's all sorts of stuff going on there.
Wow.
Yeah.
Wow. 896-0713, 800-349-0713 are our phone lines. If you have a question for the doctors regarding the endocrine system or anything in particular, you can give us a call, and we'll be glad to pass that along to them. This is our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy. And we'll be back in just a moment. Back to our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy with Dr. Jim and Janine Fox of Doctors Nutrition, located on Cowan Road in Gulfport, just south of Pass Road. We're talking about the endocrine system this morning. And Huey of Wiggins, what is the difference between endocrine glands and exocrine glands? Easy for me to say.
That's easy for him to say, right?
Yeah, really.
Okay, an endocrine gland is one of the part of the body that excretes hormones, messages. Again, back to Dr. Pearl's work and where she termed it messenger molecules. The exocrine system, for instance, your sweat glands. You sweat, that's excreting something. Doesn't really have well, I guess it does have a signal. It tells everybody else you're sweating and whatever. But things like your saliva glands, those things excrete various things, but they don't have a hormonal
They excrete
activity.
really needed things in the body, but they're not hormones.
Right. It's not a messenger between
And the
systems.
endocrine system is your whole hormone system. And we mentioned the thyroid, we mentioned adrenals.
Right.
What you also have to mention, we mentioned melatonin and being that being a hormone also, but your sex hormones.
Right.
That is part of the endocrine system too. The ovaries and the testicles are part of the endocrine system.
Exactly.
And they all affect each other, which is why we start seeing a lot of endocrine problems in middle age when people start going through either menopause or andropause, because it does affect it.
Right.
Yep.
All right. Thanks for the question. Lillian of Moss Point, what is the pineal gland?
Pineal.
Pineal gland? Does it affect hormones or sex drive?
Well, you know, the pineal gland, of course, is in the brain. It's a little walnut-shaped or, you know, nut-shaped thing deep in the brain. And one of its biggest contributors to anything is melatonin.
Right.
I mean, that's one of its biggest. Now, there's a lot of other hormones that it excretes.
Right, and the melatonin can affect sex hormones, but actually the pituitary gland is probably a bigger thing in increasing affecting the sex hormones.
Right, yeah, the pituitary, especially the anterior pituitary, is part, I mean, and this is something the size of a pea, and we've got it divided into anterior and posterior, front and back. And so it's very small. But the pineal gland itself, you know, like I say, it does have, you know, the effect of the melatonin.
Right.
But, you know, it doesn't get involved in directly affecting.
But one of the things we wanted to talk about today is how everything affects everything.
Yeah.
Because say it is not working properly and you're not producing your melatonin and then you're not getting any sleep. That lack of sleep then affects the other hormone production.
Like your sex drive.
So it does. They all affect each other, and that's one of the things we wanted to get across to today.
I think
is
that's
that it all affects. That's why you don't want to check just one thing. You know, people come in and say, "Well, I have a thyroid problem," and we say, "Well, have you had your adrenals checked?" Well, no. Well, the adrenals go hand in hand with the thyroid.
You know, and it was kind of funny because we have, I mean, many times, as a matter of fact, just a couple weeks ago, I had a young fellow come in, and he only wanted to do his thyroid. That was the only test he wanted to do. I've got a thyroid problem, and so he did. So, you know, we did his thyroid test. His thyroid's fine, but he's got all these symptoms. He said, but I've read on the internet, I've got like 8 out of 10 of these symptoms of my thyroid. I said, it could be the adrenals. Really? I said, sure. So we went back then and tested the adrenals and some of the other things, and his D and so on, you know, vitamin D, all that has big influence over it too.
On the endocrine system.
And sure enough, we had a problem, you know, so.
So you can't just check one thing, but I think that Joseph has a question also.
Yeah, Joseph of Hattiesburg, what is the relationship between hormones and cancer?
Well, you know, certain hormones will cause, for instance, estrogens and things that are estrogenic. And a lot of these endocrine disruptors are. For instance, that's one reason, you know, now that there's a lot of controversy about soy, for instance, and certain of the estrogenic compounds that it has in it. But a lot of these, when these estrogenic compounds actually cause things to grow, that's estrogen's job in nature, in the female, that when they have more estrogen than guys, and their primary role for that estrogen is to make sure that the female's got enough weight so she can carry a pregnancy and to keep her going through that. So if you've got too much of these wrong kind of estrogens, and this is where the endocrine disruptor stuff gets really complicated, because you can, you know, there's all sorts of estrogens. There's 3 basic estrogens in the female, the E1, E2, and E3, and estradiol being E2. Estradiol is probably the most prominent. Your estrone, which is E1, and then your estriol, which is E3. All these play a role, but some of the estrones, or E1, can really get messed up, and when they do, they can produce a lot of the cancer-like activities.
Yeah,
so,
and you're also you're talking about estrogen, but the other hormones play a role too.
True.
Your testosterone, when it's bound, can actually affect cancers, especially like prostate cancers. When you talk about melatonin, we talked about it being cancer preventative. When you don't have enough melatonin, that affects the antioxidant levels in the body, which affects cancer. You also look at cortisol, which I think can be one of the worst of the hormones to affect things. I mean, there might not be direct research on it, but they do know that cortisol, when it's real high, which is your stress hormone, increases inflammation, and there's no doubt that inflammation increases cancers. So all the hormones play a relationship in cancer.
And something else, one other hormone that gets really involved in cancer production, and it's called the insulin-like growth hormone, or IGF-1. And IGF-1, a lot of it comes from your liver, so we don't want to leave the liver out. I mean, the liver's right in the middle of this whole thing, you know, because it produces the majority of the IGF-1. And that insulin-like growth factor does just what it says. It makes things grow. And of course, you know, cancers are kind of growing out of control, and so it makes them grow out of control.
Out of control more. And even when you start talking about insulin, you talked about insulin-like growth factor, you talk about insulin, they know that insulin and insulin resistance increases your chance of cancer. And there's been a lot of research on that. So,
and one thing to keep both those guys under control, stop sugar.
Stop eating sugar.
Yeah.
The sugar seems to be like
always
the root of
goes
all
back,
evil.
Big endocrine disruptor.
It is an endocrine disruptor.
I mean, with so many different things, because we talk about, you know, so many times a major thing as far as helping better your health, help you lose weight, cut out sugars.
Right.
Exactly.
And diet drinks are not Cutting out sugar. No.
No, they're really not.
That's adding other chemicals, that aren't necessarily good for you either.
Louise from Pearl, can severe fatigue be a symptom of an endocrine problem?
Can be.
Yes. I mean, a lot of times it is, because that's one thing that we see a lot of times when we do our lab work is with extreme fatigue, when people have that symptom, a lot of times they're adrenals. We do see adrenals and thyroid, of course, are two big of the parts of the endocrine system, and both of those can make severe fatigue when it's not right. And with the adrenals, it's not just adrenal fatigue that makes fatigue, it's adrenal overload that also makes fatigue. So you're tired either way, whether you're making too much or too little. So that's why it's real important to check it, because you can't just go by a symptom. You have to check and see where that cortisol is. But we see a lot of fatigue that comes in due to the adrenals and due to the thyroid.
And at the same time, if somebody's got a severe fatigue like that, you want to make sure they're not anemic too.
Right.
That's
yeah.
just
You got to rule out other
routine.
things.
Yeah.
But then another thing that we see constantly, women in their 40s, their main symptom is severe fatigue. And their problem is normally a drop in progesterone, which is the first hormone to fall in premenopause. So even just a drop in one of the sex hormones can make extreme fatigue, because we see it all the time. When a woman comes in their 40s and that's their main symptom, I'm always like, you have to check your hormones. Almost guarantee what it's going to look like, but we got to check it.
Got to check it anyway.
Got to check it to see.
All right, thank you, Louise, for your question. 896-0713, 800-349-0713 are our phone lines that are open to you. We have our last segment coming up here in just a moment, and we'll also have your special of the week. It is our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy with Drs. Jim and Janine Fox of Doctors Nutrition. We'll be right back. And welcome back to our final segment of our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy with Jim and Janine Fox of Doctors Nutrition in Gulfport, south of Cowan Road, south of Pass Road on Cowan Road. It is right across from the old garden center from the old Kmart over there. They are open today, 10 to 5. They actually open Monday through Friday from 10 to 5. Saturdays, 11 to 2. The doctors are in Monday through Thursday. If you have any questions, you can stop by. Great thing about it, you don't need an appointment, and it doesn't cost you anything for a consultation.
That's true.
Linda from Moss Point is on the phone with us. Good morning, Linda. How are you?
Oh, pretty good, pretty good.
Well, good. You have a question for the doctors?
I do. I have two questions. One of them is I have this terrible nosebleed, and it gets so bad it goes down my throat, and I don't know what brings it on, and I do get it stopped eventually, but sometimes it scares my guests.
Oh, yeah.
They say, oh, my God, go to emergency room, and I don't want to.
Now,
Have you had your clotting factors checked?
My what?
Clotting
see
factors?
how quick you clot, or are you on a blood thinner?
No, I'm not on a blood thinner, and my blood is so thick that they can't even get it when I do have a blood draw. They use finders, to find my veins and whatever, and they still can't get no blood. They did get a little bit, one tube one time, but I've been several times, and it kind of scares me to get that done.
Now, sometimes it can even be some of the vessels in the nasal area that are weakened, and they sometimes cauterizing them can actually help. But an ENT,
I've had that done
you've had that done. Okay. I was going to say that's one of the things that you can do to help it. Without seeing your lab work, it's hard to tell exactly what's causing that.
Okay, maybe I could come in and bring my lab.
Yeah, do that. Do that. What's your second question?
Well, my second question is I have these. It's not cramps. It's not. It's Charlie horses.
Okay. Yep.
In my thighs and in my legs, and sometimes in my back and my neck. I get them all over my body. And they scare me to death. I think, oh, God, this is going to be the time.
And that's one that you definitely want to look at your minerals.
Yes.
You want to look at potassium, you want to look at sodium, you want to look at magnesium, you want to look at calcium. All the minerals make a huge difference.
Sure
and
can.
we even use a multi-mineral sometimes when we don't know exactly which one it is, and that'll never hurt to do it, and it helps a lot of people, because you're not the only one that has that. We hear that a lot.
Yeah.
So
that's really bad, too. That's the most scariest thing. The nosebleed don't even scare me as bad as that, but the nosebleed, it just really gets
Oh, those are pretty scary, too,
Well,
though.
bring your lab work in, and we'll be happy to look at it for you and see if we see anything there that might give you a clue on what's going on with you.
Okay, I appreciate that.
Okay, thank you.
Thank you so much for your call. Kimberly of Loosedale called in a question. Is Graves' disease caused by or connected to a problem with hormones?
It is.
Well, it is, because
It's a thyroid problem. It's an
problem.
overactive thyroid.
And it can be caused from a lot of different sources. I mean, there's, for instance, some of the viruses have attacked the thyroid. Sometimes that's been called
autoimmune is one of the biggest reasons for Graves' disease, and they call it Hashimoto's. And
well, Graves' disease is more of the hyperactivity.
Hyperactivity, which at
Hashimoto's
first
tend to link with the hypo. Yeah.
But it starts out that way.
Typically starts out
It starts out as Graves. And so when you have an overactive thyroid, there's a lot of things that can be affecting it. That's one that's a harder problem a lot of times to know exactly where it's coming from. But it's connected with other hormones because all of them affect each other.
And of course, with Graves, the overproduction of the thyroid hormones causes all kind of problems.
Oh, yeah.
I mean,
high blood pressure, severe anxiety, even tremors, shaking. I mean, there's a lot of symptoms that go along with it. So it's one thing that you definitely don't want to leave untreated.
That's true.
Wow.
Right.
All right. Thanks for the question.
Yeah.
896-0713, 800-349-0713. We have just a couple of minutes left here on our Monday morning live edition of Healthy Living South Mississippi. And we're talking about your endocrine system, or if you have a question about anything else in particular. I'll be happy to field your call and answer your question for you.
Now would be a good time to talk about our special.
We have a special this week.
We got a special.
Okay.
We always have a special. It's called DN Detox. There's supposed to be a hyphen in there, but that's okay. DN Detox. And what it is this is a 2-week intensive detoxification for the whole body to get rid of those endocrine disruptors.
Right. We just thought of something that affected all the endocrine system, and actually toxins is one of the big things that affects it all. Yeah. So we decided to put the detox product on sale this week. And so it's something, you don't do it continually. It's an occasional detox.
Yeah. Right. Is it good to do a detox? I mean, you hear a lot of people doing things as far as, I'm going to do a detox on my body and try to completely flush everything out. Is it good to do that occasionally?
It depends on how you do it.
Well, here's the thing. Rule number 1 of detoxification: stop putting toxins in. Okay. So that's rule number 1. Okay. Now from there, yes, it's a good idea to do the detoxification stuff. Clean water, clean food, because that's the majority of your detox or your toxic elements come in through that. So yeah, it's always a good idea. Okay. But it's something that's going on 24 hours a day.
Jason from Waveland has a question. My wife and I have been trying to get pregnant for more than a year now. Since what you're talking about is about hormones, can this maybe be a problem causing infertility?
Yes,
certainly can.
We deal with fertility issues a lot. And a lot of people come in and we have a panel that we do when someone is having fertility issues. And a lot of times, yes, it can be the sex hormones, but it can also be the thyroid hormones. And your regular TSH and T4 may be perfect, but it's usually a T3 problem. And so that can do it. The cortisol being high can affect the sex hormones. They all affect each other. So when we're looking at fertility, we do look at the adrenals, we look at the thyroid, we look at the sex hormones. So we do look at all of it. So that panel, if you want to come in and do it, it's like $235 because it's a little bit more because it checks a lot of things. But I do recommend doing that if you're trying to get pregnant.
Evident.
All right, and good luck to y'all.
Yeah.
Yep.
So again, 896-0713, 800-349-0713. We have maybe about a minute left. Corrine of Gulfport is on the line with us this morning. Good morning, Corrine.
Good morning.
You have a question for the doctors?
Yeah, I was admitted to the hospital in the spring with diverticulitis. Didn't know what it was, and so now I have to deal with this forever, and I didn't know if I should be having a colonoscopy, and I had one about 8 years ago, and also just what kind of the things I can do to
help that.
Help that. And then also, I'm kind of curious because I'm a flight attendant, and I was wondering if going up and down affects that.
I haven't really seen it. It might be some of the things that you eat, but we're running out of time. But so real quick, I'm just going to tell you, a colonoscopy might be a good idea if you hadn't had one in 8 years and you are having problems. But also nutritionally, we can do digestive enzymes and flora. Keep the infection out of those diverticuli, and so the probiotics are really important.
Right.
Stop by. Thank you very much for the call, and we'll be back next week talking about what?
Oh, next week?
Yes.
Next week we're going to be talking about
the nervous system. I was like, what are we talking about?
Bye-bye.